In the Indian philosophy, death is a very natural process. Our Mrityunjaya mantra starts with the death as Urvarikamiva Bandhanatum. Death is a natural separation of the body from the soul, and it has to be an inevitable thing. But from the contemporary science point of view, definition of death itself is very complex, and the definition again from all the theory point of view, it's often classified into two forms: somatic death and cellular death, two issues. Somatic death is where the functioning systems would be stopping function, and I think now most of the people know about it with the popularity of the organ donation and so on. This issue is well known. Cellular death is a situation where there is a total metabolic change, and that cellular death is really irreversible. There is a hope that somatic death may be reversible. It's not yet possible. So that is the issue. Next, the signs of real death, which we consider usually seen in that cellular death. Now, from the biochemical point of view, death again is classified into my purpose is to show where the modern philosophy or modern biochemistry misses the bus. The death again could be as if you know the physiology. In the physiology, you have the cytokines which are present, and the cytokine itself would be the marker of the death. It would be deciding like when the death would occur in the cell. So every cell at the time of the birth itself, jatasya maranam dhruvam, at the time of the birth itself, the death is predetermined in every cell. And that cell, that kind of a death is called as a programmed death. Now we call it as a programmed death in the sense where the at the time of the birth, as the genes are formed, there itself you have those vacuoles which contains that lysing enzymes. Cytolysins are there, and these cytolysins help in dissolving the cell after the utility of the function. So whatever the philosophy says, it's already there in the physiology. So there is not much of a difference. That jatasya maranam dhruvam is the cytolysins which are the evidence of that. So every cell has its programmed death. So every cell has to die, and it's a natural process which is inbuilt. But there could be the other forms of the death of the cell even. A regulated cell death. Regulated cell death is where due to some factors which change in the biochemical constitution of the cell, that cell death may occur in due course of time, like if the energy is not supplied properly, or if the oxygen is not supplied properly. So when the cell cannot do its functions physiologically normally, there can be death. Or there could be an accidental death which could occur due to many disease factors. It could be toxins, cytotoxins, it could occur. So the death can be a programmed death, or it could be a regulated, which can occur due to the other reasons, or it could be the accidental death. Now, next, the same in again about the theories about the death. Very interesting. Why the death occurs? Still there is no final theory. Now, what I have collected is that the evolution of the theories about the death in the recent few years, from 1972 to even now, the latest theory is about the alkaquins. That's the theory is a change in the pH, and the change into the alkaline pH in the cell would be the signs of the death occurring. This is what the latest theory, 2018 theory. The earlier theories, of course, there are a lot of issues. I'm not going into the detail, but my purpose is just to show like how the theory is very complex. It looks like the concept of the death itself very complex. When we compare it to what we study in our philosophy or what we study in samhitas, that we consider as a natural process. So, but the total difference about the perception of the death. Naturally, that perception of the death also would change the perception of the life even. So that kind of a difference is there, but the difference is what we do in perception. Basically, there is a similarity. Next part. Now, whereas from Ayurvedic point of view, jatasya maranam dhruvam, it is absolutely the same. And according to your all the Upanishads, including Bhagavad Gita, najayate mriyate va kadachit. There is nothing like a death as separation. It's only that you change your shape, change your body. So it's a transient state where the Atma will change its the external aids or the support structures. It's the building blocks. The physical body would be destroyed, whereas there is an eternal body. But that's the philosophy point. Whether you accept that philosophy or not, that's another issue. Next part. Now, the same programmed or cellular programmed death or the regulated death, the same is mentioned in Sushruta. There is a very interesting issue. Ekottaram Marmashatam. According to Sushruta, there are 101 varieties of the death. Among them, one is the Kala the Kala Sanyuktam Mrityu, Kala Mrityu. Kala Mrityu is the real programmed death. Programmed death where every cell is predetermined and the life of the cell is predetermined and it has to die. Whereas Sheshaha Agantavaha. Now, that's a very interesting issue, 101, and according to Sushruta, the remaining description of that 101 deaths is present in Atharvana Veda. Unfortunately, the Atharvana Veda, these branches, shakhas, which are present there, they are many. There are about 9 varieties of the branches, and among them, the Shaunaki branch is not available. Shaunaki Shakha, the source text is not available anywhere, and it is claimed that the details of those 100 deaths are present in Shaunaki Shakha. So I am not able to give you the details because it's not available. But among the available shakhas of Atharvana Veda, you don't get that description. Though Sushruta refers to the Atharvana Veda as the source of the other 100 varieties of death. I was very interested in searching for that 100 varieties of death. What are those? But that's how somehow we are not able to get that source. So whenever, if at all, we get that branch, that text of Shaunaki Shakha, probably we may be able to detail more about that 100 deaths. But it's a very interesting topic for any researcher if you can get that source. Anyway, next part. Now, about the Kala Mrityu and Akala Mrityu, the description in Charaka Samhita is very classical, very simple. Simple is he compares the Akala Mrityu to an accidental breakdown of a vehicle. Yana Samayukto Akshaha Prakriti Akshagunai Upetaha such a Sarvagunopapane Vakhyamanaha Yathakalam Swayam Sapramana Kshayadeva Avasanam Gacheta. A vehicle which is used properly and then maintained properly, even then, after a certain period of time, there is a lifetime. It has to, it become non-functional. And that's what we call as the natural wear and tear. The natural wear and tear is expected, and that natural wear and tear resulting in a death is called as the Kalamrityu. So, Tatha Ayuhu Shariropagatam Balavat Prakritya Yatavad Upacharyamanaha Sapramanam Kshayadev Avasanam Gachati Samrutyuh Kale. So Kalamrityu is a process which occurs due to the time factor. As you age, after a certain period of age, there will be a gradual deterioration of the physiological functions that results in the death. Whereas it could be due to the other causes like Eva Akshaha Atibhara Adhishchitatvat, due to carrying heavy weight beyond the capacity, beyond the load capacity of the vehicle, if there is a carriage of that, Athava Vishamapatad, the same vehicle is driven on Mangalore Road due to that parts, and it can result in breakdown of the vehicle, premature breakdown of the vehicle, or Akshachakra Bhangat, due to technical defect, the axle may be broken, or it could be Vahaka Doshat, the errors of the driver, the person who controls the vehicle. If he is not properly controlling the vehicle, it can occur in different forms of the accident, or Vishama Prekshat, due to improper positioning. The vehicle is not kept properly and is not maintained properly, or then Anupangat, Paryasanatya, due to maybe physical destruction or due to improper maintenance, Antara Avasanam Apadyate. It can get destroyed and the life of the vehicle could be completely neutralized somewhere in between due to any of those reasons. And or similarly, otherwise it can occur Tathapi Ayathabalam Arambhata. Similarly, a human being can have overstrained the body. body could be overstrained, which can result in the death. That's something like overloading. Ayatha bala arambhat or ayatha abhyavarhanat, due to improper food consumption, and then vishama abhyavaharat, again food or the total lifestyle which is not proper, a improper lifestyle, or even vishama abhyavaharat or vishama shariranyasat, improper positioning of body when you sit or lie down or walking, if the position is not proper, atimaithanat, excess of sexual indulgence, or asamshayad udirna vega vighatat, due to vega vidhirna, vidhirna or vega dharana, both these can result in these deformities in the body, and that can result in the death later, or premature death can occur, or uh, uh, Vega Vigrahat or Vigati Dharanat, either Vega Vigraha or Vega Dharana, both, or Bhuta Visha Vayu Ugrata Pratapat, due to infection. Infectious diseases can result in the immature death or premature death can occur. Then Abhigata, due to trauma, or Ahara Pratikara, Ahara Pratikara Vivarjanat, if you do not treat, if there is a disease, the disease need to be treated. If there is not treated, improper treatment of the disease, it can result in antaravasanamadhyate. It can result in a premature death, and that's called as akala mrityu. Tatha cha jaradinam atanka nishpattihi. That premature death is seen in terms of the diseases which you see. This is how the beautiful description of the death as we see in the text. Now, comparing, there is virtually not much of a difference. Basically, there is not much of a difference in what you see in the physiology. The only issue is there is a sort of discipline which is included in the definition of the death in Ayurvedic text. Next part. Now, in general, the diseases can be treated. Many of the diseases are treated. The aim of the whole Samhita or whole of the Ayurveda is to treat the disease. But there are certain conditions which cannot be treated. Now you come to a situation where the medical treatment may not give the expected results, and those are upadravestuyo yejustaha vyadhayo yanti avaryatam. So avaryata, a stage disease would come to a stage where you cannot treat with the specific treatment, and it cannot, even rasayana treatment may not produce the results in such a person, and they are in such conditions. You may come to a situation where the treatment or whatever we do as the remedial measures would become useless, like you may not dysfunctional as such. And there are certain lists of those diseases which we call as Mahavyadi, Vatavyadi, Pramehascha, Kusumarshva Bhagandram, Ashmari, Mudagarbashta, Tadhiva, Udarmasamam. These Ashta Mahavyadis also are considered as Prakrtyaha, Dushtikitsaha. They are very difficult to be treated. That could be one variety, that disease of the nature itself, nature of the disease itself could be a reason why the treatment may not succeed, fail, or depending upon the physical signs of the patient, you can decide like whether the treatment can help that patient or not. Pranamam Sakshayaha. If the patient has a reduced vitality, assessment of the vitality is one of the important aspects of the clinical assessment. If the patient doesn't have sufficient, or the vitality is not what we call as up to mark, Shoshaha, Trishna, Chardihi, Jarastata, Atisarasta Murchata, Hikka, Swasatate Vacha, Yetehi Upadrevehi Drustana, a disease which occurs is accompanied with the signs of systemic toxicity. I am translating that into the contemporary science. A disease which presents with the signs of systemic toxicity or inflammatory response, a failure inflammatory response, which presents with either vomiting or gastrointestinal tract upset as such, could be a sign. Respiratory abnormalities in a language which is the other way. That is a sign that is a sign of poor prognosis, and hence there the disease cannot be treated. Now, Sushruta and Charaka have used the word vivarjayat quite frequently, that that condition cannot be treated or should not be treated. But the real meaning of that is not that it should not be treated. Next. The real meaning is even in such conditions, you have to assess the condition, predict the prognosis, and then you'll have to plan the management. Now, that's one aspect. We'll come to that part. Now, whether the patient can be treated or not, whether the main line of the whole approach, the difference would be the main line of the disease specific treatment has to be followed, or you have to do something else for the comfort of the patient. That's the basic issue. That has to be decided based upon what we call as the Arista Lakshanas. And those Arista Lakshana, what Sushruta has given, and Charaka also has given that. Sushruta has given in a very classified manner. The Arista could be Duta Shakuna Arista, from the point where the message is given to the physician about the patient's condition. Swabhava Vipratipatti, according to the personality, changes in the personality of a person could be a sign of a improper prognosis or unusual prognosis, or Indriyartha Upapatti. If the person is not able to sense properly, then Swabhava Vipratipatti, due to the natural consequences, that could be the death signs, which we all summarize as Aristalakshana. There are many chapters. I will not go into the details of that Aristalakshana because you have studied that. And most of the times, when the students study the Aristalakshana, usually they make fun of it. And I have heard of that. When they do the Shakunarista, it is said that a messenger who comes with Muktakesha, if the hairs are not tied properly, that's a sign of poor prognosis. He doesn't know that that's a fashion now. Anyway, so maybe the issue is it suggests about the anxiety of the messenger. If the messenger is very anxious about, then that anxiety is reflecting about the status of the condition, and that is a sign of poor prognosis. Similarly, on the way to the patient, if the person sees, if the physician sees the plants or the herbs which could be useful for that management of the disease, that's a good sign. If he sees the plants or maybe the herbs of sources of medicine which do not have the same quality, that could be poor prognosis. So this way it looks somewhat odd. You may say that it's unscientific. Okay, whether it's unscientific or scientific, that we'll not go into that debate. But it could be that way. But along with that, there are the other signs which would be having that physical entity, physical assessment is a one issue. If you are not able, if a person is not able to have the proper sensations, he is not responding to the surroundings in a proper manner, then it could be the sign of impending death. Now that's again same. Yes, usnam yamagrunnati shitam usnam cha. A perception of the sensation, whether cold or hot sensation. Even now, that's one of the tests, like perception of the heat and cold is one of the common tests in the neurological examinations. And if you are not able to sense that perception, that's always a sign of poor prognosis. It may not be considered as a sign of death, but from Sushita's point of view, it could be considered as a Arista Lakshana. So on. Now, these are, it could be like some changes in the skin of the surface, skin as such, body surface, you have changes there. Then that too could be the signs of death. Next. Or it could be the smell sensation. So you have all that descriptions of the different sensations which could be present, where the taste sensation could be abnormal, sound perception of the sound, auditory sensation could be abnormal, touch sensation could be abnormal, vision could be abnormal, and so on. We'll go to the next part. Now, often it's considered as a ignorance, or many times people criticize about Ayurveda about this Arista Lakshana, and many of people have asked me, like, I have seen Arista Lakshana in a patient, but that patient has survived, patient is cured. This also is true. According to Charaka, without Arista Lakshana, no patient would die. And you have all that statement, different sorts of the statements. Now, the point is that Arista Lakshana mentioned in the Samhitas is true in that day, in those days, where you did not have the life support care. Technology of life support care was not there. Now, when you have the life care, where you can extend the life to a certain extent, maybe certain of those things are not true, maybe. Or even the treatment protocols, the availability of the drugs and the other techniques of that day also may not be true from that point of view. But there is a development in the new development in the modern science also. That modern science also, they are attempting to identify the possible signs of death in a patient. And lots of researches are done. what you have seen there is about those references of those main articles where those signs of death are now studied. You can go to that reference. And now you have come to a stage very recently, FDA has approved a test where the biomarker for death can be assessed. Still, it has not come to India. Maybe before we depart from this world, I think I could have an opportunity to go to a lab, get the blood test done, and see how far I will be living. So till now, all of us are going to lab to see like what could be the disease, and maybe with a hope like for how long we will be living. There is a possibility, at least within your generation, it will come here, it will become popular. Now it's very preliminary stage. Biomarkers of death are identified, and biomarkers of death could be even assessed, and you may have a biological definition of the life expected. So life expectation is possible to be predicted in a biochemical manner. Now, whatever our Aristalakshanas say, they have done the same issue, same factor with a different subjective method. Now you have an objective method. And these biomarkers which are studied are those mainly one asset. Now, along with that biomarkers, another issue which is quite popular and which is developing, or you have a lot of study literature, is a near-death experience in a person. That's another issue. A person Subhava Pratipatti or this Indriyartha Vipratipatti mentioned in Sushruta Charaka is a major subject of the study in the present day situation, and that out of death near death experience, it's classified as near death experience, are recorded all over the world, and now they are classified mainly, that near death experience are classified mainly into out of body type, or it could be like mystical or white light type, or a distressing type. The experience of a person at the time of the death, very close to the death, what he experienced, they are classified into three categories: sensory perception, and the perception about the response to the situation, exactly same. Subhava Pratipatti, Indriyartha Pratipatti. That's exactly the same which you see, and they are recorded. And next. The incidents of near-death experiences are recorded. I have collected that the total number of near-death experiences recorded in a classical, controlled manner. Now, for the present scientific documentation, you need a controlled documentation manner, and that controlled documentation documented near-death experiences, they are present globally and they are recorded globally. We will not go into much of the issue, but point is my purpose of showing this is to say that the idea of Aristalakshana is not simply superstition. It has been a practical issue. Now you may have certain technological situations, or you may have certain maybe controlled data, a data which is presented in a more classified manner, whereas what we have in our samhitas may not be of that category where you have that kind of a controlled classified information, but the information is still valid. That's all the point. Only thing is what we have to correct is the lifestyle and the perception of the society at that period and what we have now. As I said about that, the hair which is left free, which is a fashion and custom now. In those days, it was a rare situation, so on. So there is a good scope for modifying it, and if you modify, there could be a significant source of information about this aspect also, where the near-death experiences can be presented or maybe classified, which could be converted into a practically, clinically useful material. That's next. Now that again, what I said as the death receptors and death ligands, the chemicals. These are the chemicals which are already identified, and their trial is done. Three of those chemicals, TGF factors and FES factors, these are already studied, and now even they are hoped to be having some scope in management of targeted cancer therapy. This is the latest situation, and approval of these tests was done in FDA only in last year, 2021. So at present, whatever we can give you much information is very little, and maybe within our lifetime we may come to that situation where you may assess the death markers in the body and then decide like when you are going to death and planning the death. Maybe these are all the future possibilities. Right, next. Now, that's the other theory part. Now, let me come to the real practical part of treating with the terminally ill patient. Now, to assess whether a person is terminally ill or not, leave alone all that theory part, Practically, what we do is what we call as a clinical frailty test and grade the frailty or fitness of a patient into 9 categories. Of course, this fitness scale is often used in surgical practice. When we give a fitness certificate for a surgery or assess a patient for surgery, this universal fitness scale is followed. And that fitness scale starts with the grade 1. Grade 1 is a normal, where you have no disease at all, whereas the grade 9 is a moribund patient, where the risk factors are very high. The same, almost the same issue is described by Sushruta as the signs of a fitness in terms of गूढ़सन्धिशिरास्नायुः संहताङ्गः स्थिरेन्द्रियः उत्तरोत्तरक्षेत्रः यः दीर्घायुः उच्यते. A prolonged or a person who has a prolonged life or longer life, where the fitness is more, that's exactly the description of fitness scale, frailty scale 1 and 2. Gurasandhisirasnayam samatagraha, where the growth capacity of the tissue is more. And moreover, garbhat prabhuti arogaha yah shrani sampujayate sharira jnana vijnana saha dirghayuho. The person who never had a disease since the time of the birth and never had a history of diseases, that comes under fitness scale 3. So fitness scale 1 to 3 are covered, or frailty scale 1 to 3 are covered with, but Susha said ditto, almost the same. Virtually there is no difference. Difference is only in the language and the words selected. Interpretation is the same. Right, next. Now we come to the terminally ill. Now, definition of a terminally ill patient. That's the real topic. Now, the topic of interest. Uh, terminally ill patient, as per the definition, current definition, it means a patient who has been diagnosed as having a incurable and irreversible condition, and without an administration of a life sustaining procedure will, in the opinion of attending healthcare provider, results in a death. So for the definition of terminally ill patient depends upon whether the patient needs a life support or not. That's the issue. If a patient is depending upon, if it has to depend upon life support, then we consider as a terminally ill. Now, when it comes to the question of Ayurvedic practice, now the question was about the scope of Ayurvedic practice in terminal ill. You have that hitch. If the patient requires a life support at that level, it may not be possible to manage with only Ayurvedic line, because you need to have the life support, and if the patient cannot live without that life support, naturally there is no question. So I am not dealing at that level of that definition. So we will try to modify that level, deleting that word of life support. If you delete that life support word, and if you have a terminally ill condition where there is no other scope for cure, where you are sure that the cure is not possible, in that condition, the treatment has to be done. Now, a passive management, or a management where you do not go for a direct disease specific treatment, and the patient is allowed to die at the choice of the, maybe at the choice or other, is used, the term we use is euthanasia. In the contemporary science, it is used as a euthanasia. Now, there is again a passive euthanasia and active euthanasia. Active euthanasia is where a physician supports the death. Passive euthanasia is where the physician doesn't do anything for the disease treatment, maybe try to reduce the discomfort of the patient and manage that. And that kind of an approach is called as a hospice care. Hospice care is now meant for such a condition where the outcome would be poor. Life support is the next issue. Now, when I say terminally ill definition, life support is there. It one level compromised definition, where that life support definition, this part is removed from the definition. There, where you have a situation where there is a no scope for cure by the direct treatment or disease specific treatment, and where the whole purpose is to produce the comfort of the patient, is the hospice care, or it is also a part of the passive euthanasia. Now, passive euthanasia, next. Passive euthanasia, from our philosophy point of view, our ancestors, our great grandfathers, all their prayer would be, most of the our great grandfathers, end of the day, the prayer would be anayasena maranam bina dainena jivanam dehi me kripaya shambho tvai bhaktim achanchalam. This is the whole theme of the life, or aim of the life. Anayasena maranam, death without much of the discomfort, is considered to be one of the goals of the life. This is our ancestral way. But in the present day situation, death with comfort, death without life support is a sub judice matter. Now, my purpose of referring to this issue is there is a sensitive issue which we have to be very careful. When we deal with that patient, there is a need of being aware of these legal issues. Euthanasia is not universally accepted legally. There are a lot of issues. In India, in 2018, Supreme Court judge, the Supreme Court has accepted passive euthanasia in a very specific case of Aruna Kamath, Bombay. That's, I think, it's a very popular case, very recently. And just last week, uh, maybe you might have seen the newspapers of Wednesday or Thursday, the other day. It has again, there is a review of that our euthanasia regulation bill of 2019, where the preconditions for the passive euthanasia are modified. In the earlier passive euthanasia, before you decide like whether the patient can be maintained in a passive treatment without active treatment or not, has to be decided by a judicial component, a magistrate, a district health officer, and three teams of physicians had to give an opinion. But now, recently they have modified that involvement of the revenue authorities, that administrative authorities is reduced, and there is a modification. Anyway, the whole my purpose is there is a legal issue when we deal with such patients. So you have to be aware of that. We do deal with the patients of that sort, and in that condition, there is always a potential possibility of going for the later legal complications, and that's why we have to be very careful when we deal with such a terminal ill patient. Next, चिकित्समानः सम्यक् यौ विकारः अभिवर्धते प्रक्षीणबलमांसस्य लक्षणं तद्गतायुषः. Now, from the practical point of view, what we know is if you have a patient where the usual standard line of the treatment has failed to produce the results, that's exactly what Sushil says. Chikitsemanah samyak savikarah yo abhivartate. Even after having a standard protocol of the treatment, if the disease is not controlled, if the disease seems to be aggravating, and if the patient shows sign of emaciation, that itself is or maybe an indication where you need to change the approach of the treatment. Instead of going for that active treatment, you go for the passive treatment, and that passive treatment would be you have to go next. Yavat kantakatah pranaha. Now, of course, the passive treatment or palliative treatment starts with that issue, and the passive treatment again has the three issues: the emotional, social, and physical. Of course, legal is another. Legal, there is a big question mark, a lot of controversies there. What I have given you is just one tip of one component of that legal issue. To a certain extent, there is a permission from the Supreme Court, but it's not a total legal protection. The Supreme Court has given in a very specific case with certain preconditions, and there is a passive regulation bill passed in 2019. But that passive regulation bill in 2019 also has a lot of complicated issues. Now, when it comes to the question of this hospice care or the palliative care, there are three components. The physical, where you manage with the clinical signs of the patient and ensure that the patient is in a comfortable situation. Then there is a social issue like allowing a patient to have a passive death. You will, like how the things would be. There will be a lot of people commenting on that, and lot of different sorts of comments. And particularly when you treat in an Ayurvedic hospital, and when a patient dies in Ayurvedic hospital, everybody would say, "Mani palok dai puti jarunta." So, reasons could be many. And of course, I have that kind of an experience. Very interestingly, in our hospital, in case records, my name is written as Yam Sharma. I have repeated this joke quite frequently, and I read it as Yama Sharma because in North Karnataka, Yam is read as Yama. Now, Yama Sharma, that word is, I use that word because mortality rate of my patients is very high. Majority of the patients who come to me, they are of that category where either they have lost hope or they do not have the resources where they can manage. So, legal, now, the sensitive point is that law doesn't accept that part where a patient cannot afford the standard treatment and then where you have to go for a passive treatment, or what I don't use the word conservative, passive treatment. It's not in the legal purview. Legally, it's not accepted. So there is a very sensitive component where you have to be very careful. So I always be careful about that, dealing with the patient's party, confirming with them like about the situation, and then only try to deal with that. Otherwise, if there are any some even a slight scampering, if there is a slight doubt expressed by any one of the patient's party, immediately I would say, so you need to, beyond that theory and beyond that medicines and so on, there is something which you have to be more sensitive, and that's about one of the issues. Then social issues, then of course the emotional is most of the patients, they become, most of the persons, they may be non-believers, atheists, though they do not believe in God, and once they start believing the God, that could be one of the resurrection. And maybe at the time of the death, everyone believes in God, everyone calls the God, they will call their name, whatever the name of the God, maybe it could be any of the names as such. So at one stage everyone becomes a believer, and of course a non-believer becoming a believer can be a sign of resurrection. Of course, those who believe in God every day, that may not be. Anyway, so there is an emotional component. When you treat such patients, the family, or maybe they would have their own religious practices, prayers from somebody else, and so on, Thai Takattudiya, whatever that. I do not restrict them. Whatever, when I treat such patients, I do not restrict them. Whatever they want to do, I give them freedom, like they can do. Only one condition is, it should not produce chaos in the hospital. There should not be big sound, big chaos in the hospital. There are some centers now already in India where in a ICU there is a scope for the chanting of the mantras and havanas and so on. The religious practices are allowed in ICU in some centers. Of course, we do not have that kind of facility, but now that's what we say as the emotional care. Now, emotional and social issue is something different. But I would be dealing with would be about mainly the physical aspects, the treatment aspects. Legal, I have put in a lot of question mark. Next part, resurrection. Now, um, though we consider vivarja, the word is used as vivarja many times. Responsibility of the physician would be yavat gantakataha pranaha. You will have to treat the patient tavat chikitseta. Till the last minute you need to treat. That's a physical responsibility of the physician. Now, what we mean by that? At one stage, Samhita says vivarja, you are not supposed to treat. At next stage, you say yavat kantakataha prana. That itself is an indication that you have to change the approach of the treatment. Instead of going for a specific disease-specific treatment, you have to go for a passive euthanasia sort of the treatment, or a passive care asset. And now that legal issue which I said about would be the now court has defined, Supreme Court has defined about what can be considered as a medical negligence in the passive care. Now, this class Bolam test of medical negligence is a very specific legal test to assess about the passive care, that passive euthanasia from that specific context. Of course, this is not from Indian Supreme Court, it's from the global judiciary, maybe USA judiciary, that Bolam clinical test. Of course, in Indian courts also, that Bolam test is called as valid test of that. There are certain cases in India where this Bolam test also was used as it, but the source of that Bolam test is from the Western country, probably USA. I'm not very sure. Probably USA. The test that the basic concept is in all other medical negligence cases, to confirm whether a treatment protocol is proper or not, you need to have a medical board, and that medical board will decide based upon the data, the accumulated data. But in case of the passive care, the issue is other way. If a group of doctors follow the line of treatment which is followed, which is done at that condition, that cannot be considered as medical negligence. So if all Ayurvedists are following the same line of treatment, our Bolam test is passed. So whatever we follow, we consider as the passive care protocol. If all Ayurvedic doctors are following the same, then the Bolam test should be passed, and there may not be a legal issue. And you need to follow the rule of yavat kantakataha pranaha tavat prayateta. You need to try to improve the physical condition of the patient. Usually, The word which I use is, I don't give life to the patient, but I give life to the, sorry, I don't give days to the life of the patient, but I give life to the days of the patient. This is what I would generally use the word. Right. Now, with this, now the most important part of the management in a patient of a terminal ill patient is, and the most, the real issue would be the pain management. Now, pain is a very common symptom of every disease. In all other diseases, of course, it's a, you have that specific line of the management. In a terminal ill patient, that approach is slightly different. A bit about what we know about the pain. Now, definition of pain itself is changed. Now, latest definition, which is passed in 2020, is it's an unpleasant sensory emotional experience associated with or resembling that associated with the actual potential tissue damage. Now, in 1979, the definition was there has to be a damage, tissue damage as an essential prop. Now they have added a resembling that of the associated damage. Now, very interesting issue. Definition of the pain also is changing. Pain, which is a everyday experience, it's also changing, and this kind of issue is there. And in 2013, a presidential form, this task force is decided to redefine the pain. So within a short duration, we will have a new definition of the pain also. So, and that defining pain itself is a painful process. Now, the next part, of course, this. Now, we just skip that. Skip that. That's not necessary. From Ayurvedic point of view, the pain, of course, is very simple. We categorize pain as a adhyatmika and adhibautika. Adhibautika pain is what we feel as a physical pain, which may be named as the synonyms badha, vyatha, dukkham, and so on. Whereas the adhyatmika is the other part. And among the adhyatmika, you have shariraha, manasaha. Sharira as among that sharira, vatapitta shleshmabhyam veshabhya. So pain is produced due to visheshana of vatapitta kapha. That's all the point. Manasamtu, kama, krodha, lobha, moha, etc. That's also the vyatha or the pain. From when we define the pain from the contemporary science point of view, that manasa pain is not included. That part is not included. It's only about the physical pain. So definition of pain in Ayurveda and definition of pain in the contemporary science, if you compare that, definitely yes, the definition of pain in Ayurveda is the real holistic pain, where every aspect of the pain is suggested. Whereas there you use the word deemed sensation of the pain as such. Whereas you have a definite cause for the pain, like kama, krodha, lobha, moha, maya, etc. as such. Next part. Now, to assess the pain is again very complex issue. How much of the pain? Everybody would say that my pain is severe. In Malayalam, Kerala people, every patient would say Bhayankara pain. Bhayankara word, I'm not hurting the sentiments of any Malayalis here, but that's a very usual thing. Bhayankara. There is no other word probably for that severity of pain. So I'm really, whenever my patients say Bhayankara Vedana anta ಹೇಳಿದಾಗ, I would be Bhayankara anta. This is a real issue. So the whole issue is description of the pain and the feeling of the pain would be a very subjective issue. And to assess the pain is very difficult. And among all the research attempts, assessment of the pain itself is very difficult. And the most popular pain assessment would be what we call as the faces pain scale. By looking at the face, you can assess. By looking at the face of the audience, I can feel how much painful my lecture is. It's now reaching the grade 5. In many majority of the people, it has crossed the grade 5. Some it has reached to 8 or 9. So that assessment of the pain can be done by looking at the face as such, and that's considered to be the most standard. The other way is the patient himself or patient herself can be noting about the scale about the pain. So that's about the assessment of the pain as such. Next part. Now, why the pain occurs? Theories about the pain. That's again very interesting issue. Again, I will not go into the detail, all that, the physiology of the description of the pain. There are a lot of theories about the pain as such. And the description, why the pain sensation, rather every sensation would occur, would be a now very beautiful description mentioned in Charaka. I just quoted this or referred to this statement because that consists of all the gists of what we call as the pain theories, different theories of the pain. भेदात् कार्येन्द्रियार्थानां बह्व्यः बुद्धयः स्मृताः आत्मेन्द्रिय मनोर्थानां एकैकः सन्निकर्षजाः. Atma Indriya Manortha Sannikarsa would be the cause of pain, which everyone has read. There is a very specific further Anguli, Angusta Talaja, Tantri Bina Nakhodbava, Drishtaha, Shabdaha, Yata Buddhi, Drishta Sanyoga Jayatha. That Sanyoga combination of Angusta, Anguli in a Veena, that musical instrument, which will produce different degrees of the noises, different varieties of noise. You may have low pitch, high pitch, and so on. Musicians would have that innumerable number of variations of the sound sensation. Similarly, the pain sensation also could be varying. Now, what the contemporary, just go on pressing one by one. The contemporary theories would have the theories of the pain as the same, the different sorts of gateway theory or soul lock theory or the plantation theory or intensity theory. There are the different theories, and all that theories, they are exactly, they can be fit into that simile of Veena Tanti. And that's exactly the same. Maybe that itself could be one subject for one lecture, like the comparison of the concepts of the pain and the description of Charaka about the Veena Tantivada. So I will not go into that part. Now, coming to the means of pain management, simple issues, to maximum simplify, the pain is produced due to a tissue damage at the periphery. Now, this is about the somatic pain, not the psychological. Manasa pain is not included in this. That somewhere the tissue is damaged, and the damage is carried through the sensory nerve to the spinal cord, reaches to the higher centers. To manage the pain, just one by one, to manage the pain at the level of the source of the pain, where the pain is produced, you can have local approaches like cold or hot, depending upon the type of the pain, or local management like local anesthetics could be one. Nerve block anesthesia, where the passage of the pain sensation through the nerves can be stopped. Or it could be the treatment at the spinal level, where the spinal anesthesia could be given. Or even you have the spinal or epidural, this has to come first. Now, spinal or epidural would be at the level of the blocking of the sensation there. So, up to here, the drugs are very specific. Up to the level of spinal, the drugs are very specific, and probably we may not have sufficient means of Ayurvedic medicines which can act at this level, except that cold and heat. Cold and heat is a common issue, but as far as the pain sensation produced, means of preventing the pain at that level, we do not have that much. But when it comes to the higher level, the central level, you have the drugs which can produce the sedation, like opioids or the other sorts of the centrally acting drugs, and a big group of drugs which the modern people would consider as a placebo. Now, I use the word placebo with the reservation because that word is used by the contemporary science. But many of our Ayurvedic drugs, they act at that level where the pain sensation perceived at the higher center can be modified. Yeah. Now, I don't use the word placebo over there, or I don't bother about whether you use the word placebo otherwise, but it reduces, it makes the patient improve, and majority of whatever we use as the pain relief, majority of the drugs which we use, I'm not going to that specific drug now at this level, that's at that level. Then, of course, you have the general anesthesia. And there is one real issue where the pain can be modified by your modifying your pain perception, the sensation as your sensory capabilities, like yoga, meditation, samadhi. Contemporary science doesn't have any of that description. I have seen people where the whole pain sensation can be controlled to a great extent with the samadhi. I have a direct experience of having a hydrocele surgery over this Ganga in the Varaha Baba in Banaras. When I was in Banaras, Baba, Devaraha Baba, he would be living on Ganga only, Ganga river only. He would have a platform and live that, a very unique person. His demand was he had hydrocele, and my professor L.N. Singh was one of his had contacts. Maybe he was one of his devotees also. And his demand was, you should not give any modern drugs, no injections. You should do hydrocele surgery. and he would not come to the hospital. Uh, and LM Singh said, okay, all right, we'll do that. And I was his assistant as a student. Now, what he did was, now, Devara Baba, there's certain very funny issues that Baba was quite popular for making the treating infertility patients. And the treatment he would give for infertility is probably he would not take it. Probably he has never used a soap. So if you just rub his body, that you will have a pill coming up. And the people would come in boat to his this platform, and he keeps the foot on their head, blessing with the foot, and then gives a pill. He just rubs over the body, gives it, and the person has take, and then they will have issues. These are all the things which are there, and they are true. Now, for that patient, where from the contemporary science point of view, hygiene is not there. He would not allow us to apply Dettol or the iodine solution, spirit, no issue. He would just say that Ganga Jal pour, dal. So we poured Ganga Jal, and he took a deep breath, ab shuru karo. Surgery we did, hydrocele surgery, Professor L.M. Singh has done, and I was the assistant. I tried to pull the testis bit more, like whether he really feels the sensation or not. He was cracking vulgar jokes. He was throughout the surgery, he was cracking vulgar jokes and making us laugh, but he never felt the pain, and wound healed primarily, without any complications. I have seen that. Till then, it may not be believed, but when I have experienced it, seen it, naturally, you have to believe. There is no objective scientific data, describe it scientifically. May not be possible. It's not possible at all. So, yoga, samadhi, and so on, that what we call as the succinct issues. There is no scientific description, but there is a huge potential in that area where the pain can be modified. We may not have that capacity, but there are certain issues, and definitely, yes, we can have a positive outlook about that issue even. So that's the one part. Next part. Now, the next. Now, in the contemporary science, now I'm not. My purpose is not to criticize the contemporary science as such. My purpose is to show the scope or niche where Ayurvedic people can do something. From that point of view, I need to show about the limitations of what the contemporary treatment. Now, for the contemporary science point of view, there is a limitation for the pain management. And that limitations of the pain management, as the guidelines, the standard guidelines, is a use of more than 6 doses per day of hydrocodone or hydromorphine, the morphine derivative, is a sign that there is a failure of the pain management. Or use of long-acting extended release opioids such as oxytocin fails to produce the relief, then it's called as a failure of the management. And most of the patients with the terminally ill conditions, they would be of that category where that standard protocol of the pain management has failed, and still the patient would feel the discomfort and they come for the Ayurvedic treatment. So my purpose of referring to this issue is only from that point of view, that where you have a group of patients, maybe it's not simple, it's not a few patients, you have a large number of patients of that category where that standard protocol of morphine and morphine derivatives have failed to produce the relief of pain, and they come for Ayurvedic treatment. Next part. Now, there you have the real scope for the management of the pain as such. Now, what I consider would be, from Ayurvedic point of view, you have two approaches from our textual theory. Now, bit of the theory, practically what we do is something different. From Ayurvedic point of view, Sushruta has referred to that pain management in a very specific manner in case of by enhancing the tolerance of the pain. And the tolerance of the pain is enhanced by Anna Sanyoga. The Prakshasrakarma system Bhuje Taturam Bishak. Before the surgery, Sushruta would suggest the patient to have a food which is nourishing, and Madhyam Chapayat Madhyam Yo Madhyapaha. Madhyapa only. Those who are addicted to alcohol are given alcohol, but many times it's misinterpreted. Many times it's interpreted that Sushruta gives alcohol to every patient. It's not. Sushruta has not given alcohol to every patient. Those who are alcoholics, and because of the alcoholic habit, their pain modality, pain sensation has been activated. They are more sensitive to the pain. To keep them in that controlled situation, you have to give alcohol. So that's only limited. But the other part is most important. Nam murchati annasanyoga. If you maintain the nourishment of the body, proper nourishment of the body by rasayana, balya, aushadhis, that are ahara. Now, rasayana, balya is my addition to the commentary, but Sushruta has mentioned there is about the ahara. You can have a better tolerance to the pain. If a patient is well nourished, the patient can tolerate the pain. He may not use the word bhayankara, maybe slight, lesser than that, some lesser degree of that. The scale of the pain may change. The facial pain, scale of the pain may change if you have maintained the nourishment. That's one. Then another part is about the diversion of the attention of the patient to something else beyond the pain. But Sushruta has suggested is suhrudaha vikshipantyashu kadabhi pranvedanaha. The person, if he speaks with his friends and colleagues and would have some talk otherwise, other than his disease, then that would be a relief of the pain. Now, this what we call as subjective or maybe placebo, but it is absolutely true. If you make the patient laugh, some unusual jokes, somehow you make the patient laugh at that moment, for that day the patient would be remaining healthy and he would have a good sleep. In my post-operative patients, till our post-graduation centers, students have come up. It was a rule that every surgery, whatever minor or major, I would be visiting the hospital at night. And if I visit and talk to the patient at night, the patient would not require an analgesic dose. If somehow I don't visit the patient, then the patient would require analgesic dose. Now, after our PG students are there who are disturbing the patient most of the time, I do not go to the post-operative ward at night unless it is absolutely needed. When they report, then only I go. Otherwise, I don't. And that in that condition, patient requires a night top. Analgesic is required. Diclo, injection diclo in at least first day. It may be required in many of the patients. Now, this is an absolutely true. Of course, we do not have such a documented record of that. So, documented, structured result output, but it can be done. So, that kind of issue where diversion of the attention of the patient from the source of the pain can be very effective issue, and particularly in the palliative management, this would be one of the important method. You divert the attention of the patient from the disease, somehow have some talk by which the patient would laugh, and this is what I generally do during the rounds. During the rounds, if there are some patients complaining more, somehow I crack some jokes at that moment, whatever that spontaneous, and make the patient laugh, and that itself would be a good remedy for that day. Next day, you have to find a new one. Right, next. Now, acute pain remedies. Now, Sushruta has suggested textual description is या वेदना शस्त्र निपात जाता तीव्र शरीरं प्रतनोति जन्तोः घृतेन सा शान्ति मुपैति सिक्ता कोष्णेन ST मधुकान्वितेन. Local application of ST madhuka is suggested in surgical conditions, which may not be very relevant in the context of a terminal ill patient. But in terminal ill patients, Taila Abhyanga, Svedana, Sarvanga Abhyanga, Svedana would be very useful in a very severe painful condition where you do not know the exact source of the pain, where all the other means of the pain relief, all that remedies, standard protocols of the pain remedies are not giving the results. Svedana and Abhyanga can relieve pain significantly. Patient can have a better comfort. Now, when I say this, it's not that it's a cure, it's only about the palliation, and it is possible, and the patient can have a good comfort at that level. Next. Now, the other part, from again, bit theory part of it, when we say the pain modularity or the physiology of pain, particularly somatic pain is produced due to damage of the tissue, and the damage of the tissue releases the chemicals which we call as the mediators of the pain, chemical mediators of the inflammation, as well as they are the real causes of the pain, and they are of different varieties. Mainly either it could be plasma derived or maybe the cell derived, and it could be either histamine or arachidonic acid, or it could be platinum activating factor, activating factor, or cyclones, and so on. The next. Now, from Ayurvedic point of view, simply that the different type of the pain, the feeling of the pain, that description of the pain itself is a criteria by which you can assess the real issue. Now, the cytokines of different sorts when they produce the pain of acute pain. Now, particularly bradykinin and bradykinin, particularly bradykinin, it produces the acute pain whenever it is released in a tissue damage, that produces the acute pain, which is described in Samhita as the Vataja, Sramsa Vyasa Vyasa Swapasada Rukta Vedanam. All that types of the pain is suggestive of a bradykinin release. And when the bradykinin is released, it results in the symptoms like fever, chills, and fatigue, and particularly acute pain, at times nausea. I consider them as a Vataja pain, and in that condition, the management would be just one thing. In that condition, my drug management would be, options of that drug would be Yogaraja Gugulu, Vishumusivati, or Smithsagarasa, or at times, if it is related to the gastrointestinal tract, Agnitunivati. Maybe one of them or few of them, depending on the patient, not that all the drugs are given. Or another of the important, in case of Vataja type of the pain. Now, when I say Vataja type of the pain, it's just about assessing the severity of the pain as it is presented by the patient, not the biochemical issue. We do not have the facility of assessing the bradykinin level and then say like whether it is Vataja or not. But clinically we can make out, and in that condition, Dashamula Niruhabasti or Ksharabasti. Particularly, Dashamula Niruhabasti is preferred when the symptom of pain is like a neuralgia type, where there is a radiating type of the pain, and no organic damage at that level. There, it's the Niruhabasti is given. If there is a inflammatory component and it's related to the muscles, the myalgia, then a Ksharabasti is preferable. If the patient is emaciated and there is a sign of degeneration of the disease, in that conditions, a Rajayapan Basti could be preferred. So, different sorts of the Basti. Selective use of the Basti can be a good remedy. Again, I don't say that it's a cure, the same issue. It can be a good remedy for the passive management of the pain. Right, next. Now, in case of the prostaglandins, the inflammatory conditions, the symptoms produced are exactly the same. When you have that burning sensation, temperature being raised, that's all signs of bradykinin, the prostaglandin relief. And in that prostaglandin relieved conditions, exactly the similar symptoms are seen in the Pittaja variety. Pittasya daharaga ushmapakita, svedaha, kledaha, sutihi. Now, clinically, you can definitely identify these patients complaining of exactly the same symptoms. Pain, it's not a simple one word. Patient would use that word, different words. Patients use the word based on their experience. Cigarette dealer kapun, two dealer kapun. These are all the words. Fire and so on. They compare it to any of their experience. Now, that kind of the experience, that word description itself should be a guideline to assess the intensity. And if it is of a Pittaja variety, the next, in that condition, the main management would be the choice of the drugs, depending upon, again, the other patient condition. When I say this is the drugs, it's not that every patient is given all the drugs. It's only about selective. In some conditions, it could be Sutashekara, Kamaduga, Arogya Vardhini, and Chandraprabha. Many times, my internists, when they call, like one patient is complaining of pain, for some I say Gokshiraregul, some say Sutashekara, some may Nabhivati, and they are confused, like, ab kya karna hai? So, it all depends upon these issues. The finer aspect of the assessment of the pain, that what you suggest about the treatment. And then, of course, the other sorts of the approach, the interventional approach could be cold packs, Matra Basti, Tailadhara. These could be the options in case of patients presenting with the Pitta Jalakshana of the pain. Next. Now, Kapha Jalakshana, histamine released conditions, where you will have that itching as the major clinical signs, or maybe the angioneuritic edema, where there could be hardness over the area. That's exactly the clinical symptoms which you see in case of the Kaphaja Vyadhi Lakshanas, which also could be one of the signs of which you can come across next part. And in that condition, the usual my management would be Lagu Sudsekara, Kaisharogulu, or Chitrakadivati, again, depending upon the other issues, the other context situations. Ksharabasti or Sweda could be the other options where these symptoms could be managed. So, pain management as a palliative treatment is one issue. Next. The next part, one of the very frequent complications which we meet with in the terminal ill patients is the bed source, the pressure source, where virtually from the contemporary science point of view, we have very little to do, but a lot of literature. Literature, you have many pages, tons of literature, but practically very little to do in case of the pressure source once they have occurred. Prevention, of course, we have many means of prevention. Now, once the patient has the pressure source, in that condition, uh, prevention aspects, of course, all that aspects are true. Whatever we consider in the contemporary science, they are true. But once the pressure source have occurred, all that what you have to do is have hygiene, maintain the hygiene, passive exercise management, and the position, changing of the position of the patient. But specific Ayurvedic protocol of the treatment would be, once the tissue is debrided and you have a clean surface, till the tissue is debrided, it may not be possible. But once the tissue has become debrided and then you have relatively clean indication, then Trifalakwata for Parisheka, or cleaning with Trifalakwata, Jatyadi Tela, and Brahmana Basti like Rajayapan Basti could be the option, which can hope, you can have a hope of maybe at least a healing of a bed sore. But it's not possible. Every patient may, it may not be possible to heal the condition. Many a times it may not be possible to debride the condition. The slough cannot be removed. Slough would be continuously extending. In that condition, Trifalakwata may not be of use. In that condition, we have to use the other substances like hydrogen peroxide and so on. So many of the patients, we may not have a opportunity to use the Trifalakwata in case of bed sores. But once we come to a stage where you can have some evidence of the granulation tissue, some evidence of that slough tissue is gone, then Trifalakwata Jatiya Tela would produce a dramatic change, the whole game changer. The whole tissue, scene would be changing, and there could be a very rapid, real outcome. Though the opportunities to go into that level of the treatment may be very few. Anyway, that's about one of the options, right? Then another very common issue in case of the terminally ill patient, Dr. Sridevi was talking about the same issue. Patients with the malignancies and so on. Uh, my choice of the treatment in all that, anorexia is one of the very frequent complications. The reason for anorexia could be physical, systemic, or maybe psychological, because the patient already knows that there is a poor prognosis. Naturally, it could be many of the causes. So going into that level would be difficult. But when there is a visible psychological component, I would prefer Smritsagarasa or Kamaduka. If there is not much of a physical component, then it is a psychological component, then in that condition, my preference would be Arogyavardhini Kumaryasava. Arogyavardhini Kumaryasava is generally preferred in case of anorexia of terminally ill patients without bothering about the dosha lakshanas. Anorexia in other conditions, that protocol of the treatment and approach would be something different. But in a terminally ill patient where you prefer a passive care, Arogyavardhini Kumaryasava does a good thing. And Smritsagarasa or Kamaduga can be added on if the patient has a visibly that depression symptoms. Next, the uh, last part. I'm just referring to one of my worst experience of dealing with the terminally ill patient. It's in 2014, 2013 and 14. I'm referring to one patient name I have masked, like young boy. The whole history is of a young boy, around age of 25, only one son of the mother. He had a very huge one. He had a very huge astrocytoma. The MRI scan, image of the MRI scan is there. Image of the MRI scan shows almost 70% of the whole cerebrum is occupied with the tumor, and virtually incurable. That patient had a proved diagnosis of astrocytoma, and he had a persistent seizures, convulsions, was treated naturally elsewhere, and as usual, at the end, जिसका कोई नहीं है यारो, उसका कोई SDM है यारो, the patient would come to SDM. So the patient had come to SDM hospital in the same, with the, not with a hope. They never had a hope. And it's a very emotional factor. I'm just referring to that case because it has really touched my emotions. Mother was taking care of a son. Mother was old, around 60 plus, and the son was in 20s, late 20s, and only earning member in the family. And the patient had come in a totally moribund state. Throughout the body, there were bed sores, and virtually we couldn't count the bed sores. And the patient had persistent seizures throughout the day. Any stimulus, simply sitting on the light, would be precipitating the seizures, and absolutely hopeless, but severely suffering. Patient was really suffering. That seizures, when you look at that patient, young patient having the seizures with all that wound around the body, the scene would be very terrific. So even that very stone-like perception. Now, generally, I don't get emotional, but with that patient, I had that emotions like when you could see that young boy having that and the mother taking care of that for many months. Like before the patient had come to our hospital, they had visited many hospitals and treated for more than almost 8 9 months, and then at the end they had come to our hospital. At that stage, next one, all that eye treatment was in 2016. The patient was admitted in 2016, and the whole picture was extensive bed scores, and all that treatment was multiple anticonvulsant drugs. I have given all that, multiple valproate and eptoin, all that were given naturally. Patient was kept on relative maintenance, and the bed sores. Luckily, many of the bed sores could be managed. That Ajatya Thaila and Triphala Quata, and the patient continued to be in our hospital for more than 6 months. 2016 to April 2017, he was in the hospital, uh, room number 148. Every day it was the same thing, like cleaning. The request of the mother, the patient was absolutely no, not sensitive. Glasgow coma scale was less than 8 at that time, but I have not put a oxygen as such. Somehow, gradually, the patient improved with the same conservative treatment. The same Arogyavardhini, Gandhakara Sayana was given, and somewhere at times some Kumari Asava, same drugs, same within that only, no specific treatment. Gradually, the wounds cleared, and the Glasgow Coma Scale improved 10. And the mother's only demand was once the patient should identify her as mother and call Amma. Once you do that, my purpose is over. And luckily, after about 4 to 5 months of that, patient could come to that level, and he said, Amma. That day, mother came to me, Nana Saiteda Tondreki. Now, that made me emotional. And that day, actually, I didn't sleep. See, when your mother says that, now I wish that my son would die, that makes me emotional. And even now, I remember about that situation. I do become emotional. But uh, and of course, the patient died after about 2 or 3 months of that. Later, because of progressive anemia and blood transfusion couldn't help, and the patient died. Mother thanked me, came and told that I thank you. Now, that's the importance of that palliative care. Now, my purpose of referring to this issue is like, though there is a hopelessness, absolute hopelessness, still what we consider as hope can be a different perception in somebody's view. See, a mother expecting a son to just identify me as mother and call one Amma, that's a huge demand. And if we can do that, if somehow, I don't know, I don't say that it's because of my treatment it has done, but somehow I was a mediator at that level, and that could be achieved, and mother was happy about that. Mother was happy to say, and of course there are many instances where after the death of a patient, family has come to me and said thank you. So that's another issue. But with this, it was very emotional, so I thought I would refer to this issue as such, just to say that even at that level where there is an absolute hopelessness, there is still something which we can recognize as a hope. Now, with that last part, now I said about all the death and so on, the perception of the death and so on, is absolutely not related to the topic, but a very interesting issue. uh, now, the modern science expects that there is a possibility of reviving a person who is dead, and there is a private company who is providing the services of preserving your body after death. Alcor Life Extension Services. Those who are interested, you can register your asset. The sum is quite huge, and already there are more than 201 patients and 1,400 and 1,401 inquiries with that. And if you have that kind of a huge wealth, maybe it's something a few thousands of dollars, American company, Alcor company. So if anybody is interested with an idea of living eternally, there is a hope of that sort. So it's just a casual issue, not related to the topic. With this, let me conclude. The important points which we have covered are perception of the death in Indian philosophy is unique, and this is a very important issue which can change the view about the life and death and make the death comfortable. In making the death comfortable, that Indian perception or philosophical perception of the death is very important issue. Those who have that philosophical depth of perception of the death, they would not feel the same suffering as others who do not have that kind of a perception. That's one of the issues. And hence, that philosophical mindset would be useful, particularly when you are nearing the death, like retired persons like us. Death with the dignity is the other issue. That's where you do not keep the patient on life support. Now, most of the politicians, uh, virtually they are dead, but they are kept there over the life support for many days. It, of course, there are some claims like some corporate hospitals do this, keep a life support over a dead body until that. These are certain facts. Now, whether I'm not going to that fact, that all making the whole death indignified, loss of dignity of the death. If you are in a VIP, you have always risk that you cannot die with dignity, except probably for Siddheshwar Swamiji. Now, recent one, the best example for that death with dignity is about Siddheshwar Swamiji. Very recently, that I think everyone knows about that. That's an example of how the perception of the death could be in an Indian situation. So that's the issue. But bar you have all the other issues like controversies of sentimental issues, legal issues, which you have to be very careful when you deal with that. Theoretically, yes, that life dignity, death with the dignity is a very positive issue, but we will not take it absolutely positively. There is a issue which you have to consider other way. In the contemporary situation, there are a lot of repercussions about that, and hence we need to be careful. Ayurvedic approach in such cases is relevant and practicable. There is still a scope, even if life support and such high technologies may not be used, still we have a scope. With this, let me conclude. If there are any questions, I try to answer and then conclude. Thank you.